I'm with the Department of Epidemiology at the University of North Carolina, and I also work with a project called Measure Evaluation. And one Measure Evaluation has many projects around the world, and one of them has to do with structural interventions, particularly as they pertain to women's land rights and HIV. So what I want to do is talk about the call to action to deal with structural interventions or structural drivers or social determinants. They have several names. Take a quick look at some of the intervention progress, the challenges in evaluating those interventions, and then I'm going to suggest some steps to move forward. One of those call to actions has come from the U.S. Centers for Disease Control, and I'm not going to go into any detail on these slides, but just show you some evidence that some large agencies are talking about social determinants. So here's the CDC, and World Health Organization has a commission on the social determinants of health. Here is a coalition of organizations, and they are addressing social drivers of HIV/AIDS. And a foundation, also U.S.-based. You all know, I suppose, that I am speaking from North Carolina in the U.S. So here is an organization that is U.S.-based, the Robert Wood Johnson Foundation, addressing vulnerable populations, and then down at the bottom line you see a new way to talk about the social determinants of health. How do we think about social determinants as they contrast with other things? Well, if you look at the top line here, I've got three different factors that can cause disease. They range from the left side, the biological, and then the middle, behavioral, on the far right, social. And if we think about interventions that correspond to those, the biological factors would be intervened upon with typically a clinical intervention, a pill, a vaccine of some sort. Behavioral interventions, well, they have behavioral interventions and messages that are aiming to shape behaviors. And then social factors, that's where we see these structural interventions, trying to shape the structures of society and how people interact and behave within those social structures. So one way of looking at the contrasting, let's say, the behavioral with the structural is as they relate to personal volition or will or self-discipline. On the high end, requiring a lot of personal volition, are things like getting people off drugs, and there the message is, at least it was in the U.S. some years ago, just say no, just don't do it. And so that's a lot of personal self-discipline required there. The structural approach to that would be to, say, fight the drug cartels so that there is a lesser supply of drugs. In the realm of HIV, the message would be have fewer partners. That's personal volition. On the structural side, if we alleviate poverty, then perhaps people would not need to engage in behaviors to gain an income. In the realm of obesity, the messages are usually exercise more and eat less. A lot of personal volition there. In the structural context, it's going to be walkable neighborhoods, neighborhoods that encourage people to get out and walk around. So I want to give an example of a structural intervention. This is a very simple example, but an entertaining one that relates to that last point about walkability. have an example of how making something fun could change behaviors and just changing the structures that are presented to people. So another way of thinking about structural interventions is in the terms of proximal and distal. We talked about volition, high volition and low volition, and now I'm going to talk about proximal and distal, where proximal is where things are close to each other and distal is where they are far apart from each other. And in epidemiology, which is my field, we will often draw diagrams like this to talk about what we think is affecting what. Now, if you focus on the C and the A, and we might be saying that we want to take a look at how C affects A, then we might find, well, there's an intermediate step called B that's kind of in between C and A, and we might say that there is some extra factors to consider. D is something that is not in that line, but it's outside there and needs to be considered. In epidemiology, we'd call that a confounder. And when you're looking at two things that are proximal to each other, the number of other variables to consider is and that's the goal, to keep it small and controllable so that you can really study the two factors that you're interested in. When they are distal, the Z and the A are far apart from each other. And it's not just, when you have them far apart from each other, it's not just one variable in between them, but many variables. So this is one of those slides that we were working on, that we got a slow start on. So let me just walk you through what's going on here. Take a look at the Z and the A. You'll see them again there. And that ball of string in the middle is meant to show that it's a mess of stuff that occurs between the Z and the A. And if you look at those letters, the L, J, C, 0, R, F, those are all other variables that are kind of jumbled there in the middle that one needs to keep track of as you are studying the relationship between the Z, or the Z, as others would say, and the A. Furthermore, if you look to the right of the screen, it's not just the A that is affected, but you see a U, E, X, M, B. And this is meant to show that when you're dealing with something that is structural, you're often dealing with something that is fundamental, foundational in society. And those fundamental things will change not just one outcome, but many outcomes because they are so fundamental. So in addition to the physical structures, like the stairways that we saw, there are some social structures. And this photo on the left is meant to convey legal structures that would affect this woman on the right, who is a woman in Africa working in her field. So there are social structures that can affect whether this woman is able to keep her field or to have land to grow food on. This is another one of the layered slides, and you're not going to be able to see the layers build, so I'll just tell you what's in here. This is like one of those earlier series of slides. This is showing all the different organizations that are paying attention to women's land and property rights, and they include United States Agency for International Development, ActionAid, the International Center for Research on Women, the UN, and the World Bank. So again, just to show that this is a topic that is getting a lot of attention. And here is the mechanism that people are talking about of the connections between land rights and factors that can shape whether a person gets HIV. So let me just walk you through this. This is a lot of information. So let's start with the left, and it says the lack of land rights, and you go to the top. And if a woman loses her home, she could lose control over her life. If I were to lose my home and not have other family to rely on, I would be living in some place far away from work and perhaps having a hard time getting to work, and I would be losing a lot of control over how I structure my life. Now, the reason a woman might lose her home is that her husband could die, and if she is in a society where land is handed down through sons, then her husband's family could come back and say, we would like that land back now. And if she loses that land, then she could lose the home that she's on, and that would be the way that she would lose her home. Looking at the second line, she could lose her income-generating property, the ability to grow food and sell it in the market, and that might lead her to try some income alternatives. She could lose her land that would cause her to be unable to grow food just to feed herself and her children. And that can lead to those things on the far right. I haven't made arrows there because they're not linear. They happen in these convoluted ways, but the outcomes could be less able to remain in treatment for HIV if she has it because she can't get to treatment. There could be less condom use because she has less control of relationships. She is more vulnerable economically and has less power in relationships. She could end up having more sex partners because that might be a way that she is gaining favors or gaining income. Notice that the yellow line there at the bottom points out the relationships that are proximal, that are closer to each other, and the red line, the relationships that are distal. And notice that when we look at the distal, we have a lot of things that come in between and a lot of different paths, and think back to that bundle of string in the earlier slide. So some of the interventions that have been tried have included things like land reform, who gets the land and what are the means by which it is kept or taken away. Some effort has been put into talking with judges and sensitizing them to the issues around land rights. Also sensitizing communities about what the issues are so they can pay attention to the problems. They can look for abuses that occur. And then some effort to empower women, to make them aware of their rights, where those rights exist, so that they can claim them. Because one of the issues that has been found is that there might be land rights, but they're not enforced. And if women are aware of them, they can take them to court or they can make some noise so that their rights are protected. So the evaluation challenges are both a rights perspective and methodological challenges. Under the rights perspective, notice that I've used the word women's land rights. When people claim rights, they assume that there are going to be good outcomes because this is a fundamental human right. Just like the right to be free from torture, the right to have land or to not have land taken away is considered something that is fundamental, and some people who are working in the rights don't want those things to be measured because that implies that everything is subject to measurement when they are making the argument that it's not about measurement at all, it's simply about what humans should have. But I would argue that if you don't measure these things, the occurrence of land grabbing, then how are you going to maximize the health benefits? How are you going to know what works best to give women the things that are also one might also consider rights, like access to health care? Now, let me talk about some methodological challenges. We're going to walk through these in order, starting at the top. One of the things about structural interventions is that they affect everyone. They are like a legal structure. People in that society all live under that law. Now, if everybody is under the same law, how are you going to compare them to somebody else? If you might have to go and compare them to another country, for example. And if you compare them to another country, there's a lot of other things that are different, and so the comparison becomes very difficult. They are context-specific, meaning that the laws if we just take Kenya and Uganda, two countries that I'm familiar with, if you take Kenya and its context, the Uganda context is very different. They may have the same law, but the way it's going to play out is going to be quite different. We have in epidemiology this term a counterfactual, which means that the road not taken. If you think of the stairways, the counterfactual to the escalator was the stairs that look like a piano. When you have something that is so complicated and context-specific, finding a counterfactual, a very clean counterfactual, is very difficult because you want everything else to be the same and just one thing to be different. And if you You're not going to find that to be the case between two countries that neighbor each other even, like Uganda and Kenya. There is so much that changes when you just go over the border. And then if you do find something in Kenya that works, how can you generalize that to other countries in Africa, because their contexts are very different. I already mentioned that there are many paths and many variables in between the thing that you're studying and the outcome that you're interested in. Then there are also feedback loops, things that go one way and the other way. So one example of that would be that if a person loses their land, they may be more vulnerable to HIV. It's also true that if a person gets HIV, they may be more vulnerable to lose their land. So things go in two directions, and how do you tease that apart? When I mentioned in the next line interdependence, when we are doing statistical tests, those tests require that things be independent, not interdependent. And when you don't have that independence, then you can't use a lot of the statistical tests that we care about. I'm not going to dive into exactly what interdependence means. That could take some time, but just know that some of the statistical tests are just not going to apply to the kinds of comparisons that we would like to do. Then there are many outcomes. Think back to that slide with the bundle of string and all those letters on the right side of the screen. Which of those are you going to measure? And if you measure one and it you don't find a big effect, you might find big effects in some of those other letters that are there. And so you don't want to miss if there is something good happening. And then the time lag, how long do you wait to see whether there is an effect? Next slide. So the way that people would react to this is they might say, well, I just give up. Science doesn't apply to this, and let's just leave the social determinants for the politicians, let them take care of that, and let's work with a human rights approach. I would say, rather, that science is bigger than you think it is, or science is bigger than some people think it is, and that there are ways that you can use science to untangle and deal with these methodological challenges. There is an area of science that deals with complexity. There is an institute in the U.S. that does complexity research, and there are some folks in the realm of evaluation that are dealing with complexity, particularly the one on the right, Michael Quinn Patton, is dealing with what he calls developmental evaluation. And folks in complexity talk about levels of it. The most basic or the simplest they call simple relationships between variables. I would call them almost mechanical relationships. Then there are complicated, that goes to complex, all the way up to chaotic. I'll give an example of these. A simple example would be looking at this child and getting a vaccine. Once that needle enters the skin and the vaccine gets in, it follows physiological processes to have its effect. So it's almost a mechanical effect on that child. I would also note that the comparison of the stairs and the escalator would be a simple comparison. A complicated comparison of things might be looking at vaccine programs, where there are many steps, but people generally understand what they are. And if you compared the vaccine program in one nation versus the vaccine program in another, it would be complicated, but you would know what to compare. You would look at the quality of the cold chain, for example, and whether vaccines are kept cold all the way to the delivery point. And then we get into complex. Now, this is a picture of a network, a social network, and in this case it is of individuals. I do work as it relates to organizations and how they relate to each other. And in these pictures, if you look at the very top, you'll see 3 red dots. And the arrows between those 3 red dots have an arrowhead on each side of the line. And that indicates that each of those dots affects the other, meaning a two-way relationship. That is one of the challenges that I mentioned about the methods, is that things go in both directions. And in these networks, that is the case. And then chaos, they would describe as the global economic challenges, where nobody can agree on exactly what happened and what is needed to fix it. In complex systems, there are things that we find that are some of the challenges that we face. One of them is the non-linear relationships. That's the back and forth that I mentioned. There is unpredictable variation. In these networks, you can't know how a particular person or organization is going to behave tomorrow and how that's going to affect everybody else. Then people talk a lot about emergence when they're talking about complexity, that as these organizations or these people in this network in the upper right, as they interact, you will see movements that emerge from those interactions. You will see leaders that emerge. You will see innovations that emerge from the interactions, none of which could be predicted from the start. Then these networks will adapt to things that will occur in their context. And there will be some uncertainty about how to react to things and what kinds of actions to take. And then no matter how well you understand a network on one day, it can change and become something else a little further down the road. So when we are thinking about complexity and we're thinking about structural interventions, there are some things that we need to keep in mind. One of them is that context matters. We can't just pick one thing in one community or one country and apply it in another country. Everything is context specific. Another challenge is that there is no obvious comparison, which is going to make some of our studies and our study designs different than what you see for, say, a vaccine trial. You're going to find that if you find a system that works, it's going to be impossible or perhaps inappropriate just to pick it up out of that one place and put it in another because of that context that was already mentioned. I can also mention that there will be parts of this system that are not complex, little bits of it that we can understand well and very clearly. And the last thing I would mention is that as we approach complexity and structural interventions, one of the key things is that we ask the right questions. I'll explain this a little bit more clearly. The question that we ask of simple systems is, does it work? So here is a slide that is showing a clinical trial. It's a particular version of a clinical trial called a crossover design. And this is a trial where they're asking the question whether amantadine, this particular drug, works if it achieves the goal that is intended for it. But when we're looking at complex systems, the question of does it work might not be as applicable. If you look at this network, asking whether it works would be a challenge because it has so many different functions and it's always changing. So some of the things that you might ask of this network are a bit different, like what's happening in this part of the system? How can we increase the positive outcomes from this system? How can we make the system more efficient? How can we adapt it from one context to another? Those would be questions that pertain to a complex system. So the methods that we can use in epidemiology, we can use multi-level methods. That means that we look at individuals, we look at organizations, we look at districts or provinces, all at the same time. Those are multiple levels. We can use qualitative methods and not just quantitative ones, and we can use mixed methods where you mix the quantitative and the qualitative. We can use network analysis. I've been showing you pictures of networks, and there are some very well-established methods for studying how those networks work. And then we can use some mathematical simulation where you are playing with the variables to see what happens when you change the values and how the rest of the system responds to that. So some steps to move forward, I would suggest, in particular with women's land rights and HIV, taking into consideration this complexity, is to clarify how we think things are working, to define all the variables that are involved, to prioritize the most important questions. What are the variables that should be studied first? Then let's see if we can find data that relate to those variables. Let's create a simulation and play with those ideas and see if we can learn anything more just by playing with the numbers to see how things affect each other. And then let's evaluate some of the interventions or components of the interventions. Something maybe we need to look within a complex system to find some proximal variables to understand how they are affecting each other, to evaluate whether that part of the system is working well. So for simple components within a large system, one can apply traditional methods. For complex questions, we're going to have to apply some of the complexity methods. And so in my work, we are writing a journal article on how to move forward. It's a literature review of what's been done and what is known. I will tell you from the start that most of what we have found is anecdotal and qualitative. We're not finding much quantitative information on the relationship between land rights and HIV, which doesn't mean the relationship doesn't exist. It just means it hasn't been measured. And then we're looking to see if there are any existing data sets that could help us answer some of these questions. And we're interviewing some organizations in East Africa. And we're doing this with ICRW. I believe there's a representative from ICRW on this call, but we're working in East Africa, not India. Next slide. And my last point here is to encourage us and others who are interested in structural interventions not to force a complex peg into a simple hole. When you have something that is complex, let's not just apply the kinds of tools that would be used for more simple kinds of research questions. There we are.
I was wondering, James, if you could say a bit about how have donors and others in the field of HIV responded to your discussions in terms of saying that when you're dealing with complex systems, the question of does it work is sort of a mismatch between the complexity and the question. And the reason I ask that is, as a network that's supposed to be generating, evidence about the role of structural drivers, my experience is that many donors, what they really want to know is, does it work? And yet they want to know, does it work about very complex kinds of interventions? And I was just wondering if you had any reflections on that kind of discussion that you've had.
That's an excellent and a challenging question. So I've given this same talk at USAID and a subsequent talk where I build on this. They've been well received, but I would note that USAID is a large organization and there are camps within. There are people with different perspectives within. And there are some who are very sympathetic with the notion of structural interventions and complexity and the different kinds of questions that need to be addressed. And then there are others who are, they gravitate towards the questions that can be answered clearly. Some of you know that there has been a lot of activity around mHealth lately, which is around the use of cell phones in global health. And I think one of the reasons is legitimate. They're new. It's a new technology. New things can be done. But another one of the reasons is that these are simple questions to ask, and people will gravitate towards the simpler questions. You can measure whether somebody has used a cell phone or not. You can measure and count the frequency of cell phone use. So to not answer your question, Liz, is to say that there are both things happening with USAID. There are those who are recognizing the need to grow in the capacity of dealing with complexity, and those that would just kind of shove it aside. And one of the big challenges that we face in HIV, and I know that this talk is not strictly about HIV, but one of the challenges is in some of the advances around the AIDS drugs is that it's been found that in a couple where one is infected and the other is not, that if you treat the person who is not infected, that transmission decreases dramatically. Now, that's an important finding, but there are people in power who are going to say, okay, let's all run in that direction. Let's just push aside these more difficult questions. And it's a challenge for us, for you, to present our cases when that's the kind of argument that is being made.
Right. Well, I think we definitely relate
Yeah.
to that challenge, and especially in light of the sort of resurgence of interest in biomedical approaches. So, I think we share your pain.
Liz, I have a half answer to offer on that, and I think that one of the things that we need to do, all of us who have an interest in structural interventions, is to show that where there is something that is relatively, on this scale of things, relatively simple, like a vaccine or a pill, to show that those things work in the context of social structures, that they're not taking their actions in a vacuum. We have health systems that they have to be a part of. We have social belief systems that they are a part of. And if we can take the thing that is simple and attractive and show that it's in the context of a lot of complexity, then I think that we can help people to appreciate the importance of understanding the complexity.
Okay, so I have 3 requests to speak. So I have Aika from Tanzania, and then Hillary Matthews, and then Catherine Fritz. So Aika, you want to unmute yourself and ask James your question?
Yes. Hello, this is Daniel Pilger from the Wanza team here.
Hello.
I have rather a comment than a question. First of all, thank you very much. Can you all hear me?
Yes.
Okay. First of all, thank you very much for the presentation. I would like to refer to one key question that you mentioned earlier in this talk, and it was when we talk about structural intervention, the key question is what is fundamental? And I think there's a danger of easily, when we talk about structural interventions, defining something as structural, although we're not quite clear about the structure that we actually want to address. And I give an example, for example, in your talk even, there was this example for alcoholism and having more restrictive laws about that. And I would argue that actually, taking the example of Russia, for example, there we had, after the Soviet Union had broken down, alcoholism increased tremendously, and now life expectancy in men is very low at 50 years or something. And I would argue that even beforehand, alcohol, the laws around that did not really change. However, we had a structural intervention that happened, and therefore something in society happened which then resulted in huge amounts of alcoholism. So by saying we will design an intervention and call it structural because we have no more restrictive laws on alcohol, actually we're not really addressing the root cause of what is behind alcoholism. And that is a danger, I would even say, because we easily end up by calling this a structural intervention, which in fact is not at all. It kind of even maybe preserves the structure we want to change.
That's a very good point. I have no argument with that. And what you're saying is that we may land on a spot that we call foundational, but we're actually standing on something that is even more foundational. Yes. And I can only agree. And I don't. There's no clear answer for how to respond differently, but I would say that it's not that we would say the thing that we're doing is not structural. It's kind of a relative scale. It might be more structural than some other things, but your point is that it may not be fully structural.
Okay. And just quickly adding on to this one is another point that you raised is that it's good to measure because we want to maximize health benefits. And I would say also that we might, with structural intervention, want to move a little bit away from just the health benefits because If you think about major structural interventions like Tanzania, they came the World Bank, the IMF, and they called it a structural readjustment plan. So that was structural, right? And that was clearly not motivated by health benefits. There were other benefits, the other ideas behind it. And we can show that in a lot of interventions as well, that maybe we have what I call a social impact, and that is not only a health impact. It can be an impact on the various variables, I would say.
Yeah.
That's the only thing.
Yeah, again, I can only agree with you. And it's if you think back to that slide that has the bundle of string again and all of those letters on the right side of the screen, that's what you're referring to, that these foundational things have many effects, and health is only one of them.
Thank you.
Okay. So let's move on to Hillary.
Hi, Lori. Hi, Lori. This is Maggie in Tanzania sitting with Hillary.
Hi.
Can you hear me?
Sure, yes.
Great. Okay. I have a kind of a programmatic question to go with this very interesting presentation. So many thanks for the presentation and what has been shared. And it has to do with, for people who want to move forward with testing this kind of work, where programmatically it can be located, so to speak, or what the trade-offs are for different approaches to testing this work, because it, kind of like the arrows that go from proximal to distal.
Mm-hmm.
If you're working through an NGO, which is typically small and project-oriented and in one particular context, there are going to be particular challenges for trying to address and test structural drivers. And if you move on to kind of a more sector-wide approach or a district approach or a very broad platform, let's say through media or social networking or cell phone technology where it's extremely diffuse, you may be able to get significant scale in trying to shift or modify the structural drivers, but they're going to be very hard for particular implementing agencies to undertake, including through all the kinds of measurement issues that you identified. So I'm wondering if you can talk a little bit in your experience, and Lori, please chip in through yours as well. What are some of the trade-offs around actually putting this into practice?
You ask a big question, and I don't have a big answer. I can give you a particular example, and maybe the example would help a little bit. Some of the slides had a picture of a network, and that's because I do some network analysis. An example is what I'm doing in Ethiopia right now, where we went into Addis Ababa. Addis is divided into sub-cities, 10 of them, and we went into 2 of those sub-cities that don't touch each other, so they're a little bit separate. And with each one, we identified every organization that deals with care for people with HIV and organizations that deal with family planning. These are 2 sets of organizations that seldom relate to each other. They seldom interact. Let me take a step back and tell you the context of what we were doing. We're trying to understand how organizations interact with each other because they present an organizational backdrop or an organizational structure to the people living in those communities. The people with HIV have to deal with an array of organizations because the needs of somebody with HIV are tremendous. It ranges from physical to mental health and many things in between. And so we come at this with the understanding that there are many needs, but the organizations in those areas that meet those needs often don't talk to each other or present options in a very holistic or integrated way. So we are studying how each organization relates to each other organization in terms of shared resources or referring of patients. We're able to interview each of the organizations and to quantify those interactions and show where a network is strong and where a network is weak. And then we bring all the organizations together and we show them. We say, this is your network, this is what you told us, this is how you relate to each other. What do you think of this? Are you happy with the way these interactions are happening, or do you see room for improvement? And this gives, you mentioned a small NGO. This would give a small NGO that is part of that network a view that is different than what they had before. It allows them to see how they fit into a bigger story. They are able to see that bigger story sets a context for people who are infected with HIV in their community. So this becomes very practical. It's personal to the organizations because they see themselves in that picture, but they also see a new reality and how they are part of a bigger picture. So it can change the way they see the world. It can change the way they interact with those other organizations, and thus it can also change the experience of people living in that community. So this is one way that I have taken the idea of complexity and made it very concrete, very personal in the sense that the organizations involved can see themselves in it.
Great. Okay, so we have 3 more people that have requested to speak. The first is Catherine, and then we'll move on to Catherine Dodd and to Frida Bear.
Okay.
So Catherine?
Yes, thank you. Hi, Jim. This is Catherine Fritz from ICRW DC office. And thanks very much. Hi. Thanks very much for the presentation. And I'm so glad to have you have the opportunity to focus a bit on women's land rights. I think it's a really, really interesting example of a really challenging structural type of intervention. And I wanted to know if you could just comment a little bit more on, I mean, certainly it points to the social complexity of all these structural issues and social determinants that we're interested in. But in particular, I think it helps us see the political complexity of so many of these topics as well. And especially as the U.S. government, for example, moves much more towards a country ownership model of their development agenda, including around health and HIV. I'm just curious about your thoughts right now about to what extent the enthusiasm for some of these tackling some of these issues has to do with the political barriers that are there in terms of women's land rights being in the law in the first place and then being enforced secondly.
Well, so you've mentioned country ownership, and I think what country ownership means many things to many people. You might be referring to the notion of self-determination of a country and making their own decisions, or am I missing the mark on that? Yeah,
no, definitely. And I think as well as the PEPFAR partnership frameworks, certainly Global Fund as well. I mean, all the emphasis is really on countries making a lot of decisions about what their development health agendas are going to be and how they want to use those donor funds. And while USAID might feel that property rights is important, that the political barriers to actually achieving actual change in women's property rights in terms of what countries want to do is at odds with the donor agenda. So I'm just curious about how you see that playing out in the work that you've been doing around women's property rights.
Yeah, I'm going to say I don't know. I don't know how that's going to play out. It gets back to one of the earlier questions we dealt with, and how structural interventions are viewed within the field of the donors, America, UK, elsewhere, and certainly there is this impulse to aim for things that are not only simpler, but things that can be handed off to a country and then the donors could back away, which is some of the motivation behind talk of country ownership. And so so there's that thought, but then also within something like land rights, one can find that a donor will have one view of how the world should look, and that countries should look more like America, which is often the way it feels to recipients, that's what they're being asked to do. But they may have a different view of how land should be handed down and a different view of what rights are and are not. And if we are true to our claim that we want countries to own what they do and to determine themselves the paths they take, they are going to take paths that we Americans, we Westerners, disagree with. And that's a conundrum that I don't have an answer for. That I'm a father of two sons. They're very good boys, but they're at an age where I'm letting go of them, and they are going to be making their own decisions that I might disagree with. And that's just one of the challenges that we face in life. Sorry for an inadequate answer on that.
Okay, so Catherine, do you want to add? Catherine Dodds, excuse me.
Oh, sorry. Hello, can you hear me?
Yes.
Yes.
I just had a quick question, really, Jim, about any references that you would suggest would be useful for us to follow up on. I'm thinking that, for example, people working in climate change must be way ahead of us in HIV in terms of undertaking these kinds of evaluations and being persuasive with funders to move the agenda ahead. So who would you be recommending we read?
Actually, I would go a little further back in history. Climate change, there might be some things there, but I would go a little further back to tobacco use and smoking.
Yeah, sure.
Because that is if you look at the American movies from 2 generations ago, everybody is smoking, and things have changed a great deal since then. And I don't have the references in mind to tell you to go look at those things, other than just the social movement that happened there. I think that there are lessons to be learned. One of them is that things take a lot of time. The move to reduce smoking transpired over decades. And there were pieces that were bricks in the wall that were put in place over a long, long period. And some of the issues that we're talking about now are issues like land rights for women, are ones that we have realized or have made it into the forefront of our minds only recently. And there is a lot of work to be done, and if we, I guess what I need to do is argue for patience and persistence as we work towards change in these areas, because we've seen that where social change is involved, it takes a really long time.
Yeah, thank you.
One thing I can say is we'll try to put together some key articles around both complexity theory and some of the evaluation resources that James mentioned and others, and make them available on the website and through future learning labs. So I think we can do some of that homework for folks.
Thank you.
So Frida, would you like to make a comment?
Hello?
Yes.
I've put forward 2 questions which are really about the linguistics of complexity to simplicity. And I work with a charity which has a range of individuals with skills. Some of them are towards the complex end and others are towards the simple end. Undoubtedly, they're both contributory, but there is a fair amount of conflict about approaches, and I just wondered whether that's relatively common and whether, in fact, there are ways in which to label complexity and simplicity in such a way that at both ends of the spectrum people feel valuable and can conduct their projects.
So what I think you might be saying, this is something that I have been sensitive to also, that when we call something simple, it's I might say that your challenges are simple, mine are complex.
Yes.
And that doesn't feel good when you are the one who has been called simple.
Yes.
And it's one of you heard me in this presentation kind of play with some alternative words. I used the word mechanical at one point.
Yeah.
I don't know if that's an improvement. But what I can say is that I fully agree with what you're saying, that to call something simple is just a step away from calling it simplistic, which is a derogatory term. And I think we do need another way of talking about it that isn't so marginalizing.
I wondered whether direct to indirect made a contribution there.
I think that's a component of it, yes. I do.
Thank you.
Sure.
And we have also a question from James Hargraves.
James, you there?
You have to hit *7 if you're muted, James.
Hello?
There you are.
Yes.
Super. Sorry, that was me failing to use the technology. Hello there. This is James from the School of Hygiene. Thanks a lot for the talk. Jim, James, it sounds like you also suffer from the "Are you a Jim, are you a James" problem.
Yes, I do.
That one.
If you're under 40, it's a James. If you're over 40, it's a Jim.
I have a weird family, non-family distinction. Anyway, I have a question, and then maybe a kind of gentle challenge on I think what was your last slide, which I just wanted to throw out for discussion. And before doing that, I mean, I should say I have enormous sympathy with something that you said also towards the end of your talk, which is that there's a tendency often, and I think this is really real and really powerful in discussions between researchers and policymakers, where there is a tendency to go after the relatively simple to answer questions, and that belies a focus on sometimes on thinking about the relatively simple or mechanistic type interventions. And I think a lot of what this RPC is about trying to do research in such a way as to kind of challenge that and be able to talk between researchers and policymakers in these areas where there are many other things going on and where there are non-health sector concerns and there are many stakeholders, etc. And so I have massive sympathy for that, and I guess so. My question was, I know that the focus of your talk wasn't really on reviewing the literature on women's land rights and HIV, and it was kind of using that as an example as a broader. In a sort of broader discussion about evaluation approaches to structural interventions. But anyway, I'd be interested to hear whether you think, or what evidence you think there is, that there's an association between women's land rights and how bad HIV epidemics have been, or to phrase the question in another way, which is maybe a bit more counterfactual. Do you think, and do you have any evidence to suggest that changing women's land rights in any particular place or places would change the trajectory of the HIV epidemic in those places? And just, sorry, it's a very long question, but just the reason I said that is because my overall feeling, my response a little bit to this challenge that I mentioned at the beginning, I actually think sometimes we should try and use the more standard research methods that we have to address these complex questions. I think that's my bent is that I think that we will go a long way by applying some of our clear thinking in formulating research questions to some of these complex questions. And I think you can overstate actually how complex these issues are, and that almost becomes a barrier to talking between researchers and policymakers. Sorry, that was very long.
All right. I'll try to be brief because I know that our time is up, I think. So in the literature, I have found that it is mostly qualitative, mostly anecdotal. However, that's not worth nothing. It is worth something, because the stories show that there is a logic model for the relationships between the variables under consideration. Very clear and compelling stories can be told that show how one thing leads to another. And that gives us direction for looking at what could be measured. Now, if you took away from my talk that I was arguing against using traditional epidemiologic methods, then I missed the mark. What I was hoping to say is that where those questions can be addressed with those methods, they should be. And where they can't, then new complexity methods need to be brought to bear. When you have a complex situation and you can find bits of it that can be answered with traditional methods, and I do that myself. Looking at, I did a study in North Carolina where we had 10 communities, and we studied their organizational networks, and then we looked at the rates of disease. And we found that where the networks were more dense, where there were more connections within them, that rates of disease were lower, which doesn't provide a final answer to whether networks that work better are better at controlling disease, but it provides some very intriguing clues to some other research that needs to be done. So I would agree with you that we do need to use traditional sociological epidemiologic methods to get at some of these bits of the question, and perhaps with a number of different studies, if we piece together their conclusions, we can build a bigger story. One of the things that we miss in that is if we assume that a system is simply the collection of its individual components, we miss the fact that when you piece it all together, you actually get something that is greater than the sum of the parts. And how to study something that is greater than the sum of those individual parts is the challenge, is the real challenge that we face.